Good afternoon, and thanks for stopping by Across the Fence. I'm Keith Silva. Today we're talking hearts and heart health. September is National Atrial Fibrillation Awareness Month. A-Fib, as it's commonly known, is the most common heart rhythm disturbance that requires medical attention. While you may have seen commercials for A-Fib medications, many who have this condition may not even know, and the symptoms and complications caused by A-Fib can include increased risk of stroke. To get to the heart of the matter, I'm joined by a top heart man, the Dean of the Larner College of Medicine, Dr. Richard Page. Among his many credentials, Dr. Page has served as Dean of the Larner College of Medicine at UVM since 2018. He brings decades of leadership in the academic medicine and clinical care and cardiovascular research. A tenured professor of medicine and nationally recognized cardiologist, Dr. Page is a fellow of the American Heart Association and the Heart Rhythm Society, an elected member of several distinguished medical societies, and has authored more than 200 publications on arrhythmias and related therapies. Welcome, sir.
Thank you very much for having me.
Before we talk hearts and rhythms and all that sort of stuff, I want to ask about the college that you lead, the Larner College of Medicine. Out of the accredited MDs or doctors of medicine programs in the U.S., Vermont's medical school stands out, not only as the state's sole medical school, but as the 7th oldest in the nation. Talk about the Larner College of Medicine.
Well, what we have in the Larner College of Medicine, and actually in UVM in general, is a jewel. And I was recruited to serve as dean, and I'll start my 8th year in October leading the Larner College of Medicine. It's the 7th oldest medical school in the United States, but it also has a tradition of innovation, especially in medical education, active learning and the like. And actually, on Monday, we'll be welcoming 124 new future doctors as the class of 2029 gets started in their journey. In addition to medical education, we educate PhDs, and we have postdoctoral fellows that are working through the graduate college. So we have an emphasis on medical education, biomedical education, as well as research, and finally, the care of the patients that come to us from primarily Vermont and the North Country of New York and beyond. If you go to the doctor, certainly if you see a doctor in the medical center, chances are that's a member of our faculty who serves both at the medical center, in the health network, and in the Larner College of Medicine.
That's the connection. I think that's really, that's sort of the behind the scenes stuff that nobody necessarily needs to know when you come to the hospital seeking care, but the connection between the Larner College of Medicine and the hospital, that's the connection, that's where the faculty for the medical college are, and that's where the doctors are coming from.
Yes, exactly. We have a formal affiliation agreement. We have a partnership that goes back decades. And it's not just the hospital. The UVM Medical Center is a flagship academic medical center for the state and region, but in addition to that, the health network includes other hospitals in Vermont as well as in the North Country of New York.
Patient care, but also research and connected to everything.
The center of all we do is the patient, but on top of that, to educate the next generation and to learn how to better care for patients, including patients in rural parts of the state is an area that we emphasize because we really are here to serve the state.
Excellent. I'm going to follow our hearts. A-Fib. What do we need to know?
Well, first of all, I'm what's called a cardiac electrophysiologist, which means I'm basically that means I'm a cardiologist and a heart rhythm specialist. And this is A-Fib Awareness Month. Atrial fibrillation is an arrhythmia or heart rhythm disturbance where the heart rhythm, which normally comes from the top of the heart and the atrium squeezes, that's the body's pacemaker. And for every heartbeat that starts up there, there's pumping from the ventricle to the rest of the body. So it has an impulse at the top and then at the bottom. And that normally keeps our heart rate in the range of 60 to 90 beats a minute at rest. During A-Fib, the atrium, instead of squeezing once for each heartbeat, is quivering at 400 beats a minute or so. And that conducts to the ventricles, the pumping chamber, to give us a high heart rate and an irregular pulse. So if someone suddenly feels that they're just sitting quietly and they feel like their heart's jumping out of their chest, and they might feel lightheaded and they might feel sweaty, that may well be atrial fibrillation. And their heart rate may be as high as 150 beats or more, related to the top chamber going very fast, conducting to the pumping chamber going very quickly.
For someone who doesn't have your credentials, the first thing I thought of was, does having A-Fib mean you're going to have a heart attack? And those two things are separate. You dumbed it down for me well, and you said one's an electrical problem, one's a plumbing problem.
Right. You think of, I'm an electrician, that's the plumbing. Heart attacks are typically blockage characterized by acute chest pain or shortness of breath that comes from acute blockage of an artery that caused some death of part of the main pumping chamber, the ventricle. In A-Fib, there's typically not any damage, and you feel quite well if by one means or another the rhythm converts. Either we actively convert it, or very often it will spontaneously convert.
Right.
The other thing I'll mention is that's one way you can know you have A-Fib. On the other hand, in some patients, they present with atrial fibrillation. They have no idea. They go to their routine follow-up with their doctor, and the doctor feels an irregular pulse, maybe a little bit fast, maybe normal.
Right.
But they get an EKG, and on the EKG, they see that the atrium, instead of driving the heart, is quivering, and the ventricle is tracking it. But in those patients, they might not feel any symptoms. That doesn't mean they don't have a problem, because atrial fibrillation has risks.
Right. One of the things we were talking about before, you have a very nice watch on. I have a smartwatch on. This is a great tool for A-Fib. Tell me about that.
Yeah, the Apple Watch is a wearable device that can provide an EKG. By touching it, you can actually obtain what's called a lead 1 electrocardiogram that I can read on the watch, or you can transmit that to me. It's also smart enough to recognize if you might have A-Fib. So it's not uncommon for me to see a patient who has been referred or referred themselves to their doctor, and typically is then referred to me as a specialist, because their watch said they had A-Fib. Right.
And there are other devices. We don't want to just give our friends at Apple all the kudos. There are other devices that do the same thing.
Right. And there are a number of wearable and non-wearable. The Cardia device that you may see on television will allow a patient to get the device out and take a recording on their smartphone. And I have a number of patients who keep these with them. So when they have symptoms and they wonder whether they're having A-Fib, they can make a recording. It can give them some information, and they can send the information to my office, so I can actually read the EKG that they might have taken at their kitchen table.
We've only got about 5 minutes left, so I want to talk a little bit more about A-Fib. Does it affect a particular age, gender? Does it know gender?
It occurs a little bit more in men than women, but women are catching up. It is very frequent. Over the age of 80, 22% of the population will have had A-Fib at one time or another. It increases with age, but it also increases with other cardiovascular and other issues, high blood pressure, heart disease, whether it's coronary disease or congenital heart disease. There are also things that we do to take care of ourselves. Alcohol can increase the risk of A-Fib. Sleep apnea can increase the risk of A-Fib. And thyroid disease can increase the risk of A-Fib. Bottom line is, it's a very common rhythm. And if your doctor discovers this, or if you have symptoms associated with it, you want to see your doctor to evaluate the rhythm, and then receive treatment appropriate to the level of symptoms you might have and the risk factors you might have.
Right, and I guess that's the other part that we're getting to is, okay, if you have A-Fib, there's no, it's an odd heart rhythm, irregular heart rhythm. It doesn't necessarily require surgery, but that doesn't necessarily is the important part, because you can fix it.
It depends. First of all, the thing that people should understand is the main problem with A-Fib is the risk of stroke. I described the atrium normally squeezing each heartbeat. Just imagine this chamber quivering, then blood can pool in that chamber, form a blood clot that can then break off and be pumped to the brain and cause a stroke. And the higher risk patients for stroke with A-Fib include those with high blood pressure and diabetes and prior TIA and age. And the risk actually increases for stroke in women as well. So you want to assess the risk factors and give the patient a once or twice a day pill to thin their blood to reduce the risk of stroke to less than 1 in 100 per year. So that's the first thing. But in addition to that, if they have high heart rates, we want to control that rate, potentially with medicine. And if they're very symptomatic, then we do have opportunities to either give a drug or do a procedure. It's not really an operation because it uses catheters that are introduced from the legs to go up and actually burn inside the heart to get rid of the atrial fibrillation and eliminate that heart rhythm problem. So that's more aggressive. We only do that, though, for patients who are quite symptomatic and are really bothered by their A-Fib. Because, as I said, you can live a long, healthy, and happy life if you have a blood thinner to reduce your risk of stroke and possibly a medicine to keep your heart rate from going too high. And a lot of my patients were satisfied with that. Depending on their symptoms, then we get more aggressive with the care.
We talked about the wearable tech. Who should you tell? Should it be your primary care doctor? Should, do you just, I'm having an odd heart rhythm, go to the emergency room? Who do we talk to?
Great question. If you're having a very rapid heart rhythm and you're feeling lightheaded, maybe chest pain, shortness of breath, go to the emergency department.
Right.
On the other hand, if you find your pulse is irregular, if your watch or some other device tells you might have A-Fib, then go see your primary care doctor. Most of the patients I see are direct referrals from their primary care doctors. They don't all have to see a specialist in arrhythmias, but usually patients with atrial fibrillation at one time or another will see a cardiologist or a heart rhythm specialist.
Go see an electrician if you've got electrical problems.
Exactly.
Dr. Page, fantastic talking to you. Thank you so much for talking to us about A-Fib. I want to let folks know that the best place for information about all things A-Fib, it's easy to remember, it's heart.org. Heart.org. You can see it right there on the screen. My thanks to the crew here at WCX, who are all heart and, yes, never skip a beat. I'm Keith Silva. This is Across the Fence. Thanks for being part of our family.